Well, coming up next, we have a very talented gentleman who's going to talk about some of the latest strides we've made in research, some of the new things that we can keep in mind, and what keeps our hope alive as well. It's Dr. Thomas Guttuso, Jr. Thank you so much.
Hello, everybody. Thanks so much for coming today. It's great to see so many familiar faces. So before we get started, so I've got 15 minutes to talk about the latest research. We're just going to focus on one study that actually the results were just announced this past weekend at a Parkinson's study group meeting in New York. So you all will be the very first Parkinson's disease patients to hear about this study. Kind of exciting. I'm going to talk a little bit about some of the progress that we really are making. You heard Dr. Elmer talk about how he hopes and believes that in his lifetime, we will find this magic bullet, this holy grail, this way to cure or at least slow down or prevent Parkinson's disease. I got to tell you, I believe that as well. I'm going to talk to you about one of the big hurdles that we are making some progress on and some research that we did right here in Buffalo to find what we are called biomarkers. And many people in this room participated in our study. But before I get started with all that, we do, in the picture that Dr. Andrzejewski just showed, there's some new members to our team. One is a new neurosurgeon, Dr. John Riley. I don't think he's here with us, but several of you will meet him. He's a terrific, energetic, and very talented surgeon who joined us less than a year ago, I believe. And we also have a new nurse with us, Rachel Shepard, who's back there with her little baby. And she's part of the DBS team and the Movement Disorder Center as well. I just want to introduce those people. So let's get going. Latest research in Parkinson's disease. Just to kind of lighten things up, I'm going to show you guys a video to start off. And this is, do I hit the green button to advance this? Okay, so this is a little clip from a movie. I love watching movies. This is from a movie called Spaceballs. Anybody see the movie Spaceballs? It's a Mel Brooks movie. It's hilarious. It's a spoof on Star Wars. And so if you can't read this, it says, "Emergency stop, never use." And they're in a spaceship, and the villain of this movie is named Dark Helmet, which is a spoof on Darth Vader. And Dark Helmet is going to hit the emergency stop, never use. There we go.
Here, sir. Here, let me help you, sir.
Are you all right, sir?
Fine. How have you been?
Fine, sir.
Good.
It's a good thing you were wearing that helmet.
Yeah.
What shall we do now, sir?
Well, are we stopped?
We're stopped, sir.
Good. Well, why don't we take a 5-minute break?
Very good, sir.
Smoke if you got 'em.
Everybody hear what he said at the end? He said, "Smoke if you got them." So he's talking about cigarettes. And you're probably wondering, why am I showing you this video when we're here to talk about Parkinson's disease? And Dr. Elmer, he alluded to a finding that has been around, I just discovered this morning, was first discovered in 1959. This very strong reverse association between cigarette smoking and Parkinson's disease. And like Dr. Elmer said, we would never recommend to anybody to start smoking and thinking that that could help your Parkinson's disease. But it's been very curious. And the studies, there's been over 60 of these observational studies all showing the exact same thing, this big risk reduction. You're not going to be able to read this, so I'll just tell you, this is from the very first paper that came out in 1959. Which probably you're thinking that the title of my talk is Latest Research in Parkinson's, and I'm going back to 1959. So believe me, we're going to have some more information besides 1959. But I just find it fascinating that this is one of the first studies that showed that smoking is really bad for you. The graph showed about a 15 times increase in lung cancer, death from lung cancer, but way over on the right-hand side, you can't see it, but it says paralysis agitans. That's the old name for Parkinson's disease, and it showed that there was about a 70% reduced risk of developing Parkinson's disease. And they found this way back in 1959. And they also found, you're definitely not going to be able to read this, that there was a kind of a dose response. The people who smoked more had up to a 90% reduced risk of developing Parkinson's disease. And this has just been seen over and over again. We've seen this in twin studies as well. Identical twins who have the exact same nuclear genetic makeup. The twin who smokes has less of a chance of developing Parkinson's disease than the twin who doesn't smoke. All this evidence, most of it points to the fact that there might be some kind of neuroprotective factor in tobacco. And this analysis from 2007 showed the same thing, about a 77% reduced rate of developing Parkinson's disease in patients and people who smoke versus don't smoke. So this is the study that was just announced, the results over this past weekend. You know, the first thing you think of is, you know, what could be in tobacco that possibly could be good for Parkinson's? And the first thing people thought of was nicotine. And the animal studies with nicotine looked extremely positive. It protected dopamine cells. It did that in cell culture. It did that in animal models. Looked very promising. There were several studies before this one in randomly assigning patients with early Parkinson's disease to either nicotine or to placebo. And those studies kind of had mixed results. This was kind of like the big study that people have been waiting for the results for many years. This study started 9 years ago. And people were randomly assigned, 160 Parkinson's patients randomly assigned to either a nicotine patch or to a placebo patch. The study was multiple centers in the US and Germany. And unfortunately, didn't show any benefit. The nicotine patch did not show any benefit over the placebo patch. In fact, one of the outcomes looked like maybe the nicotine patch patients did a little bit worse than the placebo patch patients. So, you know, it's a little disappointing, but it's good information for Parkinson's patients to know. Taking nicotine is not going to give me any benefit. And I can tell you, I've had lots of patients ask me about, you know, while we're waiting for the results of the study, do you think, you know, just to be on the safe side, should I put on a nicotine patch? And Dr. Elmer referred to some other studies about trying to increase your uric acid levels with an over-the-counter supplement that anybody can go buy called Inosine. Increases your uric acid levels. There's some evidence that might be beneficial. There's another study with a blood pressure medication called isradipine. That's available on the market. Patients ask me, should I take these things? I met a patient at a meeting in Portland 2 years ago who, after he was diagnosed with Parkinson's, he started smoking. And he reeked of smoke. And I think the take-home message here, first of all, is that nicotine patch is not beneficial. But the other message is that, you know, as hard as it is to be patient, you might actually be doing yourself harm if you kind of jump the gun. Wait for these results to come out. We have hope that one of these studies that's going on right now, or one of these studies that is just getting ready to get going, is going to give us something that we can offer all of you that right now we don't have. But what we really don't want to do is hype it up. We don't want to give people false hope. And so it's hard to be patient. It's hard to wait for these results to come out. But the last thing that you want to do to yourself, or that we want to happen, is for you to be worse, is for us to be doing harm because we get hyped up about a treatment before we really have all the information. So nicotine patch, no good for Parkinson's, but it's still, there's thousands of compounds in tobacco. Further research may show that there's something else that we discover that actually turns out to be beneficial. That will be something that we'll have to wait and see. So this is a picture of Harrison Ford. I told you I like movies. This is from Raiders of the Lost Ark. He's holding the Holy Grail. And the Holy Grail is something that's worked into the Parkinson's literature, and it means this therapy that hopefully we will identify that will slow or stop the progression of Parkinson's. That's what's called the Holy Grail of Parkinson's research. And a big obstacle to finding the Holy Grail is the lack of validated biomarkers. So I'm not going to spend a lot of time talking about biomarkers, But basically what it is, it's an objective way to measure the brain changes in Parkinson's. So we need that in order to discover a treatment that slows Parkinson's or that prevents Parkinson's. We need to be able to measure what is going on in the brain. And most of the focus is on neuroimaging studies and also on cerebral spinal fluid studies. We can access the spinal fluid through a spinal tap. And so Michael J. Fox has invested quite a bit of money in this. There's a study called the PPMI study that probably some people here have participated in. And is following patients with Parkinson's and age-matched healthy controls for years. And just a quick kind of explanation about what a biomarker is. Imagine that you're a drug company and you think you found a great new treatment for having patients lose weight, a weight loss treatment. But nobody's discovered the weight scale. We have no way to actually measure how much somebody weighs. And so you can give your treatment to people and they can say, hey, I feel better, I feel thinner. You know, overall, my life seems to be better. I can wear smaller clothes, but you can't ever say for sure that this person lost weight because you can't measure their weight. You haven't discovered the weight scale. That's what biomarkers is. We're trying to find the scale, the tool that we need to show exactly what's going on in the brain. And so this, I'm not going to spend a lot of time on this, but this is a picture. Dr. Elmer was talking a lot about the substantia nigra, these pigmented cells in the brain. We can now image these pigmented cells in the brain with a simple MRI scan. Most people with Parkinson's have had an MRI scan. A lot of people with Parkinson's, without Parkinson's, have had MRI scans. It's a pretty simple test. And I don't know if I have a little pointer here. One of these buttons a pointer? There we go. Okay, so this is from the PPMI study, and they found this is a patient with Parkinson's disease here, and this is their midbrain, and right around this area is the substantia nigra. And you can see this is at baseline year 1, year 2, and year 4. And this blue is what's called free water. And you can see this free water increases in the substantia nigra every year, and you can see it in the bars. It's a significant increase from baseline to year 1, to year 2, to year 4. This is a group at University of Florida. They showed this in the PPMI cohort of Parkinson's patients. They showed it in a group of patients at the University of Florida in Gainesville. And we have shown this here in our patients in Buffalo. We did a very similar study and showed, where is that button? Oh boy, there it is. This increase in free water over time compared to healthy controls. So this is the kind of data that really helps researchers feel confident that we have identified something that's valid. These are different groups, University of Florida and here at Buffalo, across different patient cohorts of Parkinson's patients. Patients in Florida, patients in this very large Michael J. Fox PPMI cohort, and patients here in Buffalo. We're getting replication of findings. And this is a type of a biomarker that can now be used in clinical trials for researchers and drug companies to really help identify not only patients feeling better and they're doing better on this therapy, but it looks like this therapy is also protecting these dopamine cells in the brain from degenerating. You know, at the time of Parkinson's disease diagnosis, patients have lost about half of their dopamine cells. And people feel like, oh my God, I've lost half already. Well, you know, you still have half at the time of diagnosis. So we have a lot to protect. And over time, these cells degenerate, but there's still, a lot of them are stunned. And so we can revive them, we believe, with neuroprotective therapies. Of course, we don't have that neuroprotective therapy right now. That's the goal. This is the stepping stone, the identification of biomarkers that will really supercharge our identification and search and investigation for finding the Holy Grail. And so we also identified another biomarker that reflects cognitive changes in patients over time. And this is something that we're now collaborating with some researchers at University of California in San Francisco to query that PPMI, Michael J. Fox Foundation Index, to try and replicate what we found here in Buffalo. So progress is being made. I know it seems like it's very slow. We get disappointing results from studies. Patients will be disappointed to hear about the nicotine patch trial, though they're going to announce these results probably this October at a meeting in Hong Kong. But, it's good news to know what not to do. We'd like to find out what we can do, but it's also important to know what not to do. So in our search for the Holy Grail, we are making progress. And I would just want to finish with telling you about this study. It's a study that a lot of people in the world are very excited about. It's a strategy using monoclonal antibodies. It's an infusion to try and clear this alpha-synuclein out of the brain. You heard Dr. Elmer talk a lot about the discovery of alpha-synuclein. He thought I was in kindergarten in 1993. I was not in kindergarten in 1993. I guess I'm older than he thinks. I say, look at all the gray hair here, right? Come on. So this is a study that's being funded by Biogen. It's a very big study, and we're just getting ready to enroll in this here in Buffalo this fall, patients who are just diagnosed with Parkinson's. And they're hoping to see that these infusions help the disease slow down, that people's motor symptoms, their stiffness, slowness, and tremor slows down compared to people who are on a placebo group. But this study and many studies like this that are coming out, they are heavy into biomarkers. This study is looking at many different types of neuroimaging biomarkers, cerebral spinal fluid biomarkers. It's really a shotgun approach, and they are looking at the biomarker that I just told you about, this free water in the substantia nigra. And that is what we're going to need. We're going to need to see that patients are doing better, number one. That's most important. But we're also going to need to see one of these biomarkers move to see that the therapy not only makes patients feel better, but it's protecting the brain. So we're getting closer. Progress is being made. And thanks for coming. That's all I got.